According to the National Cancer Institute, the estimated incidence of cancer is projected to rise up to 2 million in the year 2024. This amounts to roughly 55,000 new cancer diagnoses every day. At the same time, we know that alcohol is a carcinogen, and this has been common knowledge for both scientists and clinicians. In the wake of the COVID-19 pandemic, we see that the alcohol intake has increased by about 34% in the general public. The type of cancers related to alcohol intake include breast cancer in women and colorectal cancers in the general population. Furthermore, liver cancers, which are highly affected by alcohol intake, is projected to be the third common cancer in the general population by the year 2040. This is primarily due to alcohol-related liver diseases and metabolic dysfunction-associated steatotic liver diseases. This Surgeon General warning comes at a great time when we can make interventions to our alcohol intake and further reduce our risk for cancers. Many things can affect the liver, including alcohol intake and fatty liver disease. Both alcohol-related liver disease and metabolic dysfunction associated with steatotic liver diseases are the two most common causes of liver diseases in this country. Excess alcohol intake especially can cause alcohol-related liver diseases because alcohol and its metabolites can cause direct injury to the liver cells, and this injury and inflammation can lead to scar tissue accumulation in the liver. When scar tissue accumulates over time, that can lead to cirrhosis, and many people can have inflammation, scar tissue, and cirrhosis without any symptoms. In fact, many do not know that they have liver disease. They only know when they have liver disease when they start to decompensate and have complications of the liver disease. This includes internal hemorrhage, confusion, swelling of the abdomen, sepsis, and even death. Sometimes patients go to the emergency room or the hospital for jaundicing of the eyes in the setting of excess alcohol intake that requires steroids and maybe even an urgent liver transplant. What we know now is that in the year 2023 and 2024, alcohol-related liver disease is a leading indication for orthotopic liver transplant listing as well as transplant itself. Cirrhosis is a stage of liver disease in which there is an excess of scar tissue in the liver that can lead to complications such as liver dysfunction and portal hypertension. Cirrhosis is unfortunately an irreversible process of the liver, whereas scar tissue formation before cirrhosis may be reversible with certain behaviors and medications. Jaundice is a condition where the whites of your eyes turn yellow, and this can be due to many different things, including liver disease. For women, the recommendation is 1 standard drink of alcohol in 1 day, and for men, up to 2 standard drinks of alcohol in 1 day. 1 standard drink accounts for 1 standard bottle of beer or can of beer, 1 standard glass of wine, and 1 shot of liquor. Of course, this is variable depending on how you are creating your drinks. This is an average of 7 standard beverages a week for women and 14 standard beverages a week for men. However, we all must be aware that binge drinking alcohol can certainly affect your liver and other organs significantly. Binge drinking is defined as 4 drinks or more for women in 1 sitting, or 6 drinks or more in 1 sitting for men. In the end, alcohol is alcohol. So whether or not you drink liquor, wine, or beer, it doesn't matter as long as the standard drinks of alcohol are measured appropriately. Some patients have a tendency to binge drink liquor because it comes in smaller volumes. If they're trying to stop or reduce alcohol intake, sometimes transitioning to a higher volume of standard drinks, such as a bottle of beer, can be helpful in reducing the amount that they could actually take volume-wise. Drinking alcohol is part of our culture and society, and so this advisory should not cause fear or shame in any of us. In fact, this is just a way for us to feel more empowered and use the information that is available to specialists, scientists, and physicians and make the right choices for yourself. Please talk to your doctor about how much alcohol you are drinking, especially if you're concerned about over drinking or effects of alcohol on different organs such as your liver and your risk for developing cancer. We have many programs here at Mount Sinai to help with either alcohol cessation or reduction of alcohol use. Of course, abstaining from drinking alcohol would always be the goal, but we have limitations according to addiction behavior, and I think we have to be realistic about the expectations set for various patients. The options at Mount Sinai to help with reducing your alcohol intake and hopefully abstaining from alcohol entirely include the Addiction Institute at Mount Sinai, which includes a variety of psychologists and psychiatrists, addiction therapists, behavioral therapists, who can walk you through your addiction or alcohol intake. For those of us who feel that may not be the right avenue, we have a primary care center called Reach Clinic that specializes in addiction and alcohol use, and that would be a great way for folks who do not have primary care doctors to see a doctor about their general wellness and needs, as well as talk about their alcohol intake. Furthermore, there are many resources in the community, including AA, LifeRing, Smart Recovery, that are group-based talk meetings, some religiously based, some others, some not, and they can be very helpful for patients too. In my clinic on 17 East 102nd Street, I specialize in alcohol-related liver disease, and I am comfortable with treating patients with alcohol use disorder with or without medications using the Mount Sinai resources available.